Here's the funny part. If I'm looking at this, trust concept. Told me, said,
Yeah, but here,
Thank you all for coming out. Okay, we're gonna get started now. So it's truly an honor and a pleasure to be here. I recognize so many of my friends and people I feel like are family to me. And I'm going to be sharing something with you that's going to hopefully revolutionize the way we see pain management and how we approach musculoskeletal and spine disease in the future, which is now. I want to start by asking, how many of you out here experience pain? How many of you have ever experienced pain? That could be every single person. Every single one of us experiences pain. Back pain from golfing, neck pain from sleeping wrong, shoulder pain from pickleball or tennis. We've all had pain. What I want to know is, what have you done when you experience pain? Cortisone shots. Yeah, you people have cortisone shots. What about nerve ablations? Oh, yeah, some nerve ablations. What about spinal cord stimulation? Yeah, a couple of people done that now as well. Let me ask you something deeper. What is the purpose of pain management?
You get rid of it.
Is it to mask the pain so you don't feel it?
No. Eliminate the cause.
Is it to actually feel it and resolve the underlying issue? Because here's what most people don't know. Traditional pain management is largely designed to mask symptoms, not resolve the underlying issue. And I know this firsthand. See, I'm a double board certified anesthesiologist, interventional spine, and pain specialist. I trained at the world-renowned Cleveland Clinic 20 years ago. And in 2006, when I was there for my pain fellowship, it was the top-ranked pain fellowship in the country. I learned from 10 of the top pain docs in the entire world how to mask pain really, really well. I learned how to prescribe medications, how to do nerve blocks, put cortisone anywhere there's inflammation, and really shut off those pain signals. But what I didn't learn, what we weren't taught, is how to resolve the underlying issue. You see, all of our treatments were geared towards masking pain. We treated pain like it was a disease. Pain is the problem. Let's shut it off. But what happened over time? You see, people would come in, we prescribe medications, do some injections. People would get better. They get back to tennis, back to golf, back to living their lives. And a few months later, they'd be back. More pills, more injections, maybe an ablation, maybe a stimulator. We do a lot of morphine pumps too. And eventually, surgery. What was happening, actually this really hit me pretty hard. We get these follow-up MRI studies, and what do we see? Disease progression, worsening joints, worsening spines. Then I had the realization. It wasn't really helping people. It's helping them feel better temporarily, but their underlying condition was continuing to worsen. We call it disease progression. That was the standard of care. 5 years down the line, go have spine surgery, go get your knee replaced. We did what we could. We got to that 5 years. But that didn't sit right with me. So 2021, I left the traditional pain system. I started my own practice, integrated spine pain and wellness, where I now focus on healing pain, getting to the root cause, using your own biology. We have everything we need inside of us. And concentrate that and put that where it needs to go to get to the root cause, the underlying issues, to restore function and improve your quality of life for ideally years to come. Where degeneration isn't the progression, we stop it and ideally reverse it if possible. Tonight, we're going to go over why traditional pain management is failing us. What's actually driving your pain? And why isn't it being addressed? My signature G-force method. The protocol, I'll go into detail with that. And then we're going to go over some case studies. And then I'll open it up to questions and answers. We have plenty of time for questions and answers. I know. We'll have some good conversation. So traditional pain management. I was in this system for the first 14 years of my private practice. People would come in, got some back pain, I'm a golfer, love playing golf, but my back's killing me. Okay, here's some pills, this is the insurance model. Here's some pills, let's get an x-ray, do some physical therapy. Come back in 6 weeks, let's see how you're doing. 6 weeks later, well, physical therapy's good, give me some good temporary relief, but I'm not playing golf like I used to. Okay, get insurance approval, now I'll do some injections. We do injections, and the injections are cortisone injections, all designed to mask the pain. We're not getting to the root issue. That's our system. And then the cycle repeats itself over and over and over again. 5 years down the line, people are getting spine fusions, right? Because the injections that we do with this cortisone is incredibly toxic. No one talks about that. People get cortisone shots all the time, but cortisone breaks down cartilage. It breaks down the discs in our back. It breaks down the ligaments and the tissues. It accelerates degeneration. I've seen executives come into my office, say, hey, Ash, I can't sit through a board meeting. My back's killing me, my neck's killing me. I can't fly across the country for an important business deal because I can't sit on a plane for 3 or 4 hours. See grandparents who can't interact with their grandkids. They can't get on the floor, they can't get up off the floor. I take care of a lot of golfers. I've had golfers come in. I used to walk 18 holes. Then I moved to using a golf cart, and now I'm canceling my tee time because my neck, my shoulder, my elbow, my knees are killing me. So pain isn't just physical. It really rewrites our entire life story. I tell people it takes you away from who you are. My mission is to return you back to who you are, so you can do all the things you love to do. Dorothy is one of my favorite people I'm taking care of. So she lives in Idaho in the summer. She's far from me out of the Arizona for the summer. She winters here. So her story, she had chronic low back pain and hip pain. Was seeing a pain management specialist. Did all the traditional pain management stuff. Worked well for years. Cortisone shots, ablations. Had those done every couple of years. Was doing well. Had an orthopedic surgeon for her hip, would get cortisone shots. Well, one day, earlier in, it was end of the summer of 2025, she had severe pain, fell to the floor of her house, couldn't move her legs. Her husband called 911. They went to the emergency room, got a CAT scan, told, oh, it's just degenerative changes. You go home, here's some pills and go home. So she went home, freaked out. Like, she's like, what happened to me? No one had an answer. No one explained anything. She went back to her pain doc. Pain management specialist said, well, go see a spine surgeon because it could be your spine. So the spine surgeon said, well, it's just degenerative changes. You got some stenosis and degeneration. Really nothing cervical here. Maybe go see an orthopedic surgeon. She went back to her orthopedic surgeon. You're not a candidate for a hip replacement yet. So go see your pain doc, get on pain pills. Well, she tried pain pills. She didn't like them. They didn't help. And they, gave her side effects that she didn't tolerate. So in January of 2026, she had a trip of a lifetime plan. She and her husband were taking their closest friends and family to Egypt for this luxurious tour. She explained to me, it was pretty amazing. And she came to me in the fall of 2025. She had a friend that I took care of who had a really good outcome a few years ago with the biologic therapies I do. And her friend recommended she come see me and see if I had a solution for her. So Dorothy and I got to know each other. in October of 2025. In November, we did her procedure. She followed my post-procedure protocol. And at the end of January, she went on that trip to Egypt with her family and her friends. And she emailed us almost every day, pictures of her smiling and standing and walking. And she shared with me that the people in her group are calling her the Energizer Bunny. Because she has so much energy. Going up and down stairs, walking. She had a moment, which is really special. She shared this with us. She said that they had chartered a boat, they were on the Nile, dancing in the moonlight with her husband. And she's like, this has been a dream come true. Like, I've always wanted to be on a boat, floating down the Nile, around the pyramids, under the moonlight, dancing with my husband. And we got it there. And that's why we do this work. That's what's possible. Root cause. This is what everyone misses. Because we weren't taught this. We're taught to mask pain. Pain is a disease. Back pain. Not necessarily where it's coming from. Let's treat the pain. Sciatic pain. Let's block the nerve. Amy. More family, I love it. You see, what's really happening is that we have this underlying inflammatory process, inflammation. Everyone has heard of inflammation. Inflammation starts in our bodies with the foods we eat, with our lifestyle, with our sleep hygiene, with our states of stress. All of these things can either be pro-inflammatory or anti-inflammatory. And we have this low-grade inflammation happening in our bodies, kind of like a smoldering fire, sending out these little smoke signals. Not enough to really cause any alarm or concern, but what's happening is it's slowly degrading our tissues. Our discs are wearing out, our joints are wearing out, and then we get to that critical point where it manifests as pain. And then we throw a bunch of drugs at it. Masking until it's time for surgery. Again, cortisone shots. Physical therapy I'm a big fan of. I think it's one of the foundational tools that we have for musculoskeletal spine disease, but sometimes it's not enough. Same thing with chiropractic. Sometimes it's not enough. We can have perfect alignment, but if we don't have the tissues to support the structure, we go back out of alignment. So we're not really accomplishing in there. You see, Dorothy wasn't offered a treatment that addressed the inflammation at the root. That's what I found when I saw her. Like, she's like, I just have degenerative changes. They tell me it's normal wear and tear. Why did my legs get up? Why did I have that horrible episode? She thought she would be paralyzed. I explained to her when inflammation builds up in the spine, it can trigger the nerves to have a reaction. You can get severe spasms. And that's what I think happened. She had a severe spasm in her back. Really intense when she fell. She collapsed to the ground. But I explained that to her. Like, with our biologic therapies, a serum is derived from your own body. Concentrate proteins, growth factors, anti-inflammatory, what we call cytokines, and put those directly around the nerve roots, into the ligaments, into the tissues, to not only relieve pain and inflammation, but to support the structure and give the body what it needs to become strong. So Dorothy is now 4 months since November, 4 or 5 months after her procedure, and she tells me she's stronger now than she was 10 years ago. And that's what's possible. I mean, she is the Energizer Bunny. She's doing physical therapy regularly. She does hyperbaric oxygen therapy, which we'll talk about in a little bit. She's doing laser therapy. She's doing all the things right. She cleaned up her diet. She still drinks alcohol, but not as much as she used to. I'll never make it quit because I'm a big blind guy myself. So inflammation needs to be addressed at the source. And that's what we do. Like when we use cortisone, cortisone is powerfully anti-inflammatory. There's a place for it, actually. Every now and then you can also do a cortisone shot. If I see someone in severe pain and they need help, cortisone is a great way to just calm it down. I let them know we're just masking the pain, we're just going to calm it down, and then we're going to prepare your body for true healing. And your biology is a tool. We have all these amazing technologies available to us. I can take bone marrow stem cells. I can concentrate them. I gotta put those back into damaged areas of your body. They not only relieve pain and inflammation, but they can give it the support it needs, ideally to prevent progression of disease. Same thing, I can take your blood, I can make PRP, I can make a special serum that's rich with growth factors, anti-inflammatory proteins, all these peptides. Everyone's heard of peptides, exosomes. These are all buzzwords out in the regenerative medicine world and the aesthetic world, but I can make those from your own plasma. All you, no additive, no chemicals, concentrate those and put those back in so we can heal ourselves. My signature G-force method. This is a culmination of 9 years. In 2017 is when I started learning about biologic therapies. And that's when I became aware that, hey, I'm doing everything wrong here. All the stuff I was learning in Cleveland Clinic was great for masking pain, but it was doing nothing to help people heal. This disease progression philosophy didn't resonate with me. Like, why is that okay? You know, I'm 51. Like, 40 years from now, I want this high camelback. Like, I want to be lifting weights. I mean, you know, 10 years ago, I was benching 300 pounds. That's not happening anymore. But I still want to be strong and healthy. I want to be active. I want to be present for my wife. I want to be present for my family, right? The tools we have in traditional pain management don't allow us to do that. They're not focused on longevity. They're focused on quick fixes. Quick fix. Let's get you through the next 6 months. Let's get you through the next year. You know, then 5 years ago, get surgery. Then when that doesn't work, we'll put a stimulator in you. Block pain signals some more, and then you just continue to degenerate. I've got a gentleman I take care of. I can ramble. I'm gonna give you a quick story here, because I love this guy. His name is Rob. He came to me at 87. Executive, super high functioning. It's like I got 4,000 employees. Like I've got community. I'm CEO of my company. He's like, I'm keeping my brain sharp. He's like, I got a great family. He's like, I'm surrounded by love, positivity. He's like, my knees, my hips, my neck, my back, they're starting to fail me. He used to do doubles on camelback. Up, down, 5 days a week. I don't know if I could do that. I don't know if I could do doubles once. I think that would kill me, but he was doing that 5 days a week at 85. He came to me at 87. He's like, gosh, I'm going to be 90 in 3 years. I don't want to be better at 90 than I am today. Because he's like, my mind is sharp as a tack. And he's like, I got a lot of living to do. I said, okay. So we put him to the G-force method, which I'm going to get into in a minute. 3 years later, it took about 3 years to get him there. But at 90, doubles on camelback, 3 days a week. Had built-in rest days because you need recovery. Recovery is incredibly important. 92, back to benching 200 pounds, which is incredible. But that's what's possible. You just have to be dedicated. You got to know what's out there and what's available. These guys are pretty popular public figures. The late great Kobe Bryant, BJ Singh, Pope John Paul II. Anyone have any idea what they had in common? Any ideas at all? Yeah, well, pain. Right. So Kobe Bryant suffered a knee injury, almost ended his career. BJ Singh, back injury, almost took him out of the PGA Tour. Pope John Paul II couldn't kneel to pray. What these guys did, they chose no surgery, no medications, and then went to Germany for this innovative treatment called Regenerative. Except for Pope John Paul II, he actually had Dr. Bailing go into that and treatment about it. But he can do that. But for years, that treatment was only available to the celebrities and elite athletes who were willing to travel to Germany. But now it's available right here, right now. We'll talk about that in a minute. G-force method. So this is the whole system, okay? When we're thinking about biologic therapies, I tell people, you're the pharmacy that's making stuff and putting back into your body, so make it good. I'm not a gardener, but I'm using gardening analogy, so hopefully any gardeners out there won't bring me apart for this. But we need to first prep the soil. The soil is your body. And we do that through nutrition, anti-inflammatory nutrition. That people clean up their diet. You gotta make good soil. So we do that with lean meats, vegetables. If you're vegetarian, stay away from meat, but no processed food, no sugar.
No.
I know.
Sorry.
Man, it's so pro-inflammatory. Your soil is going to be garbage. Limit carbohydrates. And I even go a little bit further for those of us who like to drink. No alcohol for at least a week or two before to prep the soil. Incredibly important. I tell people food is medicine. It's foundational. It's everything. Everything you eat feeds every cell in your body. So eat clean, eat healthy, make good soil. What else does soil need? It needs oxygen. So some of you might be familiar with hyperbaric oxygen therapy. It's where you go to an oxygen tank. It's pressurized. And what that does is it drives oxygen deep into the tissues. It gets that soil aerated, if you will. It's like tilling the soil. You see we have cartilage in our body, in our knees. We got discs in our spine. They don't have a blood supply. So what happens is when there's injury, that tissue doesn't heal. So when we're considering biologic therapies, we want to give our bodies the best ability to heal possible, best chance. And so with hyperbaric oxygen therapy, you force the oxygen into that cartilage that normally wouldn't get oxygen into our discs. And we've seen from studies that we can actually heal spine disc issues with hyperbaric oxygen therapy alone. It's pretty profound. What else does soil need? It needs light. Right? We don't get light inside our joints. So we have a laser, a class 4 MLS laser. This is Italian technology. It's been around for 25 years, 400 peer-reviewed studies in the rest of the world. In fact, Germany, Italy, France, and the UK. If you have knee pain, if you got neck pain, you got back pain, you got sciatic pain, it's covered by their healthcare system because of all the data they have on this. But that light therapy gets deep into the tissues. It stimulates regeneration. It feeds the soil. Then we do the procedure. Now you're prepped and ready. And that process can take anywhere from 1 week to 3 or 4 months. It just depends on where you are in your health journey and how committed you are to having a positive outcome. See, the thing about this kind of medicine that's different than traditional pain management is this is personalized, but it's also participatory. You have to be a participant in your own health. We're doing this as a team, and you're the key player. So we want to make this good. Then I can take your biology, whatever it is, blood, plasma, stem cells, and that's the fertilizer for the soil. So I inject that under precision guidance. So we use X-ray, we use ultrasound to deliver these cells and these proteins directly to where they need to go. Sometimes it's multiple injections, sometimes it's 1 or 2, but it's all very thoughtful and it's personalized for each individual person and their needs. Number 5, the last part of this is actually, I look at it in thirds. This is the last third, is miracle grow. We want this stuff to grow. Now, what's miracle grow? It's steps 1 through 3 again. Anti-inflammatory nutrition, hyperbaric oxygen therapy, light therapy, physical therapy. I love that physical therapy. That's an incredible part of this physical therapy, chiropractic for alignment, personal training. All the things you need to do to support structure and function. That's my G-force method. Personalized for each individual person. It can be a protocol that starts 1 week before we do the procedure or several months before we do the procedure. And it continues for years on end, ideally. So Regenerative. Most people have heard of PRP, right? How many people have heard of PRP? Familiar with it? How many are not familiar with PRP? If I say PRP, that doesn't mean anything. So PRP is platelet-rich plasma. Okay, this is something that's been around for decades. What we do is we take your blood, we take a sample of your blood, we put it in a centrifuge and spin it. When we spin it, we concentrate platelets. Why platelets? Platelets cause blood clots. They do, but they do a lot more than that. They're full of these proteins that help our bodies repair and heal injuries. So when we do platelet-rich plasma, we can concentrate our platelets from a baseline, let's say, a couple 100,000 platelets, to billions. And then we can put those back to joints, into the spine, into ligaments and tendons, and actually help tissues heal. So it's not masking pain, it's actually repairing tissue. Stem cells, everyone has probably heard of stem cells in this room. Right? So a few different places we can get stem cells. We can get that from your belly fat, or we can get that from your bone marrow, from the pelvis. Regenerative is different. This is what Kobe Bryant, VJ Singh, Bruce Willis, Oliver Stone, all these people back in the early 2000s were going to Germany to have done. Dr. Peter Veiling is an orthopedic spine and trauma surgeon in Dusseldorf, Germany. He also has a PhD in cell biology. The man is a genius. I think he must have contacted aliens to figure out how to get blood just right to create this serum. What happens is I take your blood. The blood goes into an incubator. Early German protocol. Nothing is added. It just sits in the incubator for 24 hours. What happens during that time is your platelets are releasing all their healing growth factors. Your stem cells are releasing their exosomes, their peptides, all the things your body needs to heal. You have a cell in your body called a monocyte. It's one of your immune cells. It releases one of the most powerful anti-inflammatory compounds known to man called interleukin-1 receptor antagonist protein. Mouthful. IRAP for short. I like to call it your body's natural cortisol. That collects in the serum. 24 hours after this, I spin it, concentrate the serum, then I can put that back into areas of your body that need it. The brilliance of the Regenerative program is that after we do the procedure, there's no downtime. With PRP, with bone marrow stem cells, people can get a flare-up. That flare-up can last anywhere from a few days to a few weeks. And sometimes it's not really fun. I mean, I've got people here in the audience who have gone through that, and I apologize profusely before I do the procedure, and I let them know you are not going to like me for anywhere 3 to 5 days after this procedure. But in 6 weeks, we're going to be friends again. And that's about the timeline. With Regenerative, we bypass that whole process. What's happening, that inflammatory process that happens with PRP and bone marrow stem cells, is happening in the incubator. So you don't have to feel it. That's a genius of Dr. Veiling and the Regenerative program. He designed it so people didn't have the downtime. So elite athletes, they could get back to playing tennis or baseball or football the next day. Your pain might not be better that fast, but you're not limited by the procedural pain. You're only limited by the pain you had before the procedure. It's typically a series of 4 injections done over anywhere from every week to twice a month. So it just depends on the condition for treating and people's schedules. But it takes about 4 to 16 weeks to start to notice an effect. It peaks between 3 to 6 months, but it can last 1 to 5 years. And this isn't masking pain, right? We have a powerful anti-inflammatory serum that's reducing pain, reducing inflammation. Well, cortisone does the same thing, but cortisone doesn't have all the growth factors and all the proteins you need to help heal the tissue. This serum has all of that. Everything from your stem cells has been released in the incubator. Is now in that serum. You can concentrate that, put that back into your body. Oh yeah. Dr. Veiling has trained and licensed only 8 doctors in the U.S. to do this operation program. I'm the only doctor in Arizona. So now people don't need to travel to Germany. You can have this right here, right now. So we track our outcomes. Those of us who specialize in this field of biologics. And some of you have done biologics with me. You don't get these annoying surveys at 1 week, 4 weeks, 3 months, 6 months, 1 year, and 2 year. But we track how you're doing. So it's important to collect data because there are a few hundred of us who specialize in this field across the country. And we're all part of this registry called Data Biologics. And our goal is to amass tens of thousands, hundreds of thousands of people, real live data to show our healthcare system that what we're doing is superior to what is traditional, right? That's our goal. And part of that survey is the satisfaction score. So we check in at 6 months and see how people are doing. That is patient self-reported satisfaction, which is incredible. Let me go back to my Cleveland Clinic days. We had the rule of 50s there. This is a real thing in the fellowship program. 50% of the time, 50% of the people look at 50% better. And that was success. That's a home run. Like, okay, so that's how we practice traditional pain management. Half the time we get 50% relief, we nailed it. I've never seen anything in medicine that I've practiced that has resulted in a 90% satisfaction rate in 6 months. And that's based on 916 people over the last 3 years that actually filled out their survey. The actual number is higher than that for cases I've done, but 916 people actually filled out their survey in 6 months, which is remarkable. Most people, I get text messages. Everyone gets my cell phone. When you come see me, you're part of my family. We're in this together. So journey we go on together. And I've gotten text messages like, I don't want to do the survey anymore. Make it stop. Man, it's so important. Please, no, I don't want to do it. Like, all right. So anyway. Here's some case studies. So Rick is a CEO executive, came to me with really debilitating hip pain. Had gone through cortisone shots, had a fantastic chiropractor who was seeing, came to me walking with cane, and he shared this with me. He's like, my passion is racing my cars. He's like, I have a beautiful car collection. Share with me pictures of exotic race cars. He's like, every weekend I'm on the track. He's like, for the last 9 months, I haven't been able to race because of my hip pain. Pain doc said, can't do any more cortisone shots, it's going to kill your joint. Surgeon said, you don't need surgery. Physical therapy and chiropractic were helping, but you never got back to doing anything you loved. So he came to see me. We enforced the G-Force protocol, G-Force method, used some biologics. And in 3 months, he came back for his follow-up, 90% better, walking without a cane, and asked to be released to go drive his cars because he's like, I feel good now, I can race again. So we did. 6 months later, he came back 100% pain free. He and I still keep in contact. He's racing cars, still pain free. 3 years later, this is 3 years later. We just texted a few months ago. And he's like, hey, I want to come back and do another round because I want to stay ahead of this. I never want to go through what I went through before. Meg, Dr. Meg, she's chiropractor, physical therapist extraordinaire. Very, very incredible human being. In her world, she's like, I'm not doing steroid shots. I'm going to avoid that. I'm going to try to heal myself with my chiropractic modalities, with physical therapy. Had back pain and sciatic pain. When those modalities weren't working, she came to me. She said, listen, I got a trip of a lifetime planned with my mom. It's a mother-daughter trip to Europe. We're going to visit all these countries. We're going to hike. We're going to backpack. And she's like, right now, I don't think I can do it. So G-Force method, 3 months later, better. She was 50% better in 3 months. But in 6 months, we got her right in time. She was able to do her flight to Europe, no back pain flying there, 20,000 steps a day, no pain, and then came back, no pain. And now it's 3 years later, she's still doing great. Esteban is a 51-year-old anesthesiologist. He was 51 when he came to see me a few years ago. Avid golfer and fisher. Those are his passions. So he didn't see me for years. We did some traditional pain management stuff back in the day. And he had his back pain. He's working within the operating room with surgeons. That's what he does. And one of the surgeons was like, hey, saw your MRI, I can go in there, I can clean that up and fix it for you. Well, in his head, he was thinking about the neck surgery he had. He had a fusion in his neck, which solved one problem, but created several more problems. He actually nicked his vocal cords as a mess for a year. It was a big process there. And he's had chronic neck pain after the surgery in different areas. So he's like, I'm not doing surgery. So he came to me, G-Force protocol, got his back better. He responded really fast. He's actually come to see me many times for other body parts that he responds really well to these biologics. Got another one of my favorite people. I don't know if you can see that picture, I'll tell you about it. But he's in fantastic shape, but he was training to the 7 summits. If you're not familiar with that, there's the 7 highest peaks around the world. That's what he wanted to do. He's like, I'm going to hit every one of them. So I'm training for Mount Vincent, which is the highest peak in Antarctica. He's like, halfway through his training, he's like, my knees just aren't cooperating. He's like, I'm having to take rest days, but those rest days are getting longer and longer, and it's setting me back. So we actually did Regenerative for it, and finished up his series in November. And in December, he went to Antarctica. He's like, well, before that, sorry. he said that if I can help him get his knees better, he can hike to Mount Vincent, he's gonna take me with him. Like, well, that's great, but logistically, I gotta stay here. He's like, well, then we're gonna figure something else out. So he took a cardboard cutout of my face, which is right there, right? Get closer, you can see it. And he's like, if I make it there, he's like, I'm gonna take you with me. So we did that base camp. He couldn't pack it up and take it up to 16,000 feet elevation, but he did take me with him. But that's what's possible with these therapies, right? And we're not masking pain. Like, this isn't cortisone. Could cortisone have done that? Yeah. But he's going to Denali in gym. Like, he doesn't want cortisone. He wants healthy knees. He wants healthy, strong knees. Cortisone doesn't offer you that. Oh, there's a puppy. That's Da Vinci. For those of you who come to our office, you know we have our two little puppies running around, two little Bichons. That's one of our boys there. And if you're having like some anxiety before or after the procedure, they're better than Valiant. Yeah, they'll show you out. They're sweethearts. So with those of us living with chronic pain, what's the one thing pain's taken from you that you want back? Nothing changes. Where are you going to be in 2 years, or 5 years, or even 10 years? Think about that. Like, yeah, people. Rob, 200 pounds, doubles on camelback. That's a 92-year-old I want to be. That's what I'm working towards. Your body can actually heal. What would you do? It's getting back to the life you want to live, right? We have tools to do that. See, in the future, question won't be how many of you had cortisone shots, ablations, or stimulators. It's going to be how many of you had pain that fully resolved. And we're going to see a lot of hands go up because that's the future of medicine. That's where we're headed. Not to mask pain, not to buy you a few more months before surgery, but to resolve pain for good. So the next step, we talk to Nikki. We have intake forms. You can fill them out completely, give me all the information you have. I want to get to know you. Like my people who are here who have seen me, we know each other well. Like, I'm not a normal doctor. I got the brains, all that, but it's all heart. Like, you know, when I do this, we go on this journey together. Like, your success is my success. I will not let you fail. If I can't help you, I will let you know. I can't help you. I'm not a miracle worker. I have a 90% satisfaction rate, not a 100% satisfaction rate in 6 months. So there are people who unfortunately don't respond to these therapies. But a lot of people come to me and they're like, does it make sense to try? And the nice thing about these therapies is your own body. No chemicals, there's nothing added, it's your own biology. So you're not going to have these crazy side effects. We're not going to be destroying tissue. If it doesn't work, it doesn't work. But we can figure that out together because ideally we want to. I'm going to work with you so you have success. Tonight, if you schedule for a consultation, we're doing a big discount, 50% off my normal 1-hour consultation fee. For those of you here who decide to sign up. If you have a loved one or someone close to you that couldn't be here, but wants to schedule, and they'll commit, we'll offer 75% off their 1-hour consultation. So that's a 2-hour consultation for 75% of what a normal 1-hour consultation would be. And Nikki can get you all scheduled for that. Yeah, you can't help everyone, but I'll give you a good honest opinion and let you know if I can or can't. Again, like I said, I go on this journey with you. It's not like traditional medicine where you get the shot and you're left alone. We're done. 1/3 is the prep, 1/3 is the procedure, and 1/3 is the aftercare. That aftercare can go on for years. And we do that together. I don't take insurance. Insurance covers cortisone, pills, surgery, that kind of stuff. And insurance only lets me spend 15 minutes with people. I tried that. When I first opened my practice in 2021, I tried doing a hybrid model. It was a disaster. There's people who were paying cash and I was struggling to give them the time they needed. The insurance people wanted more time, but I'm like, I can't make a living doing this. So we made the ultimate decision to go cash pay concierge. Like I said, everyone gets my cell phone, we stay connected, and we're in this together. This isn't episodic care. This is a journey we go on together. I'm all about lifelong relationships, that's what it's about. We see people from all over the world now. We've had people coming from Europe, Middle East, North Africa, and all over the country. So we can help accommodate you if you leave, if you go away, if you have friends or family from out of state, we can make it work. So my team is Nikki. I'll make sure you guys can come up there. But this is our information here. That's our office phone number. That's our website. We are on 74th and Shin. So Butterfield is the landmark that most people recognize. So we're not too far across the street from there. There is an urgent care building that's next to the fire station. We're in that urgent care building for now. So I'm going to open it up to questions and answers. And thank you all for your attention. I really, really appreciate you all.
I have a question.
Yeah, of course.
Very impressive is how many people are involved.
How many people am I involved?
Yes, how many people here, not just here, but overall, because you're very impressive. You must have a lot of clients. Just wonder how, do you work like 100 hours a week or something?
I do. About 80 is what I'm averaging right now.
He works 7 days a week.
Yeah, I work on the weekends too. Well, everyone has my cell phone, so they'll text me on Saturdays, what's going on, Greg will get you set up. I mean, but that's what it is, you know, this is an insurance-based medicine. You get my attention, you get my energy, and I got an amazing team. The people who have come to see us, I hopefully will vouch for our team. You know, Nikki has been tremendous in putting that team together to really support all of you.
When you call, you actually have somebody that answers the phone.
Oh yeah, there's no phone for you, it's all personal. Yeah.
Around two, generally, how long would it take to get an appointment?
We have openings probably,
Yes, you guys are pretty amazing.
Yeah.
Generally, it's.
see a couple weeks, 1 to 2 weeks usually. I mean, because I'm cash pay now, so I can rearrange the schedule. I don't, you know, I have flexibility.
We need to stay late on certain days.
I can't, it's me. Like, yeah,
Okay.
yeah. I mean, I have a concierge neurosurgeon who's always texting me, hey, I got this VIP client, can you get them in? We'll make it happen. Yeah. Yeah, I love this stuff. You know, it's not work for me. You know, it's my heart and soul, it's my passion. This is what I do.
So it's really a chance.
Well, I gotta eat, man. Gotta feed the doggies. You saw the little doggies. Yes, sir.
As the absolute wimp on anything medical, when I think of serum,
Yeah,
stem cells, and PRP, I think of wheels.
yeah.
I think that's the end of B. Is there anything oral that you can understand?
Well, yes.
Put a cream on the B.
Oral is food. Feed yourself nutrients. Don't feed yourself poison and toxins. That's your medicine. Yeah.
But
yeah.
you can't avoid the needles.
Well, for those type of therapies, no. But not everyone is a candidate. We do offer other modalities or a laser. You know, we're working with concierge physical therapists, not your traditional insurance-based physical therapists. We're working one-on-one with people who understand body mechanics, who aren't bound by a diagnosis code. That's the problem with our insurance-based physical therapy. You know, there's amazing physical therapists out there, but they're like, hey, I can only treat one body part at a time. That makes no sense. That's what insurance has created. Our body's connected. Like we have what's called a whole kinetic chain. You know, the ankle, the knee, the hip, the back, the pelvis, all connected. You know, if you work with a concierge physical therapist, they have the freedom to treat you as a whole person. You know, so you can avoid the needles. Diet's the biggest part of that. Working on sleep hygiene. So when we're sleeping, when we get deep restful sleep, we're in repair mode. That's when our bone marrow releases stem cells that can scavenge throughout the body. It finds areas where tissues need healing and repair. So important. Meditations, you know, prayer, whatever it is where you get connected with yourself, that's important too. All those things matter. It's all connected. But that's how you avoid needles.
So I just want to add to that, if you are apprehensive for a procedure, if you are a candidate, we do offer relaxing medication that you can take prior, so you just feel nice and comfortable during the whole entire process.
Okay.
And you don't feel, because I have the same way, I hate medical procedures. So you make sure that everybody that comes in is very comfortable.
Yeah, I'm an anesthesiologist, so. I gotta get drugs, I can keep you good comfortable, I can make it so you have no clue what just happened. You won't remember a thing.
Yeah.
Yes, ma'am.
Okay, I'm a little confused about this because I've had PRP.
Yeah.
And that came from, my blood.
Yes,
And I've had stem cell,
yeah,
but it didn't come from me. I don't know where it came from.
that's scary,
That's
scary.
for inflammation.
yeah,
And I don't even know how long it lasts, whatever, but I guess what freaked me out a little bit is if you do the stem cell, you
Yeah.
have to go into your bone marrow.
yeah, going back to the pelvis, it's not as bad as you think, there are a few people who have done it, it's not fun. But it, you know, you might be a little sore, but it goes away.
But I mean, are there stem cells out there that are good that
Well, that's a great question. I think that is gonna become the future of medicine. But right now, the only place you can get legitimate stem cells is at universities where they're doing, like research studies. There's a few places outside of the US, but you still have to be really, really careful. There are these celebrity docs that are taking care of celebrities and they're promoting these stem cells. The thing about stem cells is if they are not alive and you inject dead cells into someone, it's a huge infection risk. I mean, one of my medical heroes went to Mexico and got stem cells injected in his back by a reputable stem cell clinic, almost died. Like, it was tragic. 1 year, PICC line, drugs, and they're like, sorry, nothing else we can do. You're gonna die. Luckily, he was able to get the help he needed and overcame that. But what's happening is Arizona is laxing these stem cell laws, so is Utah, so is Florida. It's gonna be the Wild West. Any company can sell you anything. And there are doctors and practitioners out there who will see that as a money grab. You gotta be really, really careful. I mean, even 3 people in Arizona in 2024 went to 2 different stem cell clinics in Mexico. They came back, they were in Mayo Clinic, one with sepsis, one with meningitis. Can't remember what the other one had, but it's some crazy infections. And there's no recourse, you can't sue the clinic in Mexico. No malpractice there, you sign your life away, and that's the chance you take. So, that being said, I do know 1 or 2 clinics in Mexico where I've spoken to the stem cell scientist, and he's a brilliant man, and they're doing everything above and beyond. So they're checking for cell viability, which is important. If you're getting a stem cell injection that's not your own, you need to make sure that those cells are alive. And how do you do that? You have a cell biologist who takes the frozen sample of stem cells, who thaws them and under a microscope counts them to make sure they're alive before they're injected. So you have about an hour window to do that. Anything after that, they start to die off. So just be aware, be careful.
thank you.
Yeah, of course.
Really fun.
Yes.
Can you talk a little more about the science? Like, I was just reading a wee bit, you're pulling out these proteins and you're incubating them to create interleukin.
Yeah.
Just blocking the inflammatory response, or are you actually healing the underlying issue?
Great question. So one of the components is the interleukin-1 receptor antagonist protein, profoundly anti-inflammatory, binds to interleukin-1B receptor, okay? Shuts that off. That's why we get 1 to 5 years of relief, because it irreversibly binds to that receptor. What else is in the serum? Platelet-derived growth factor, BP. So all the platelet growth factors, VEGF is in there as well. There's a whole slew of peptides, extracellular vesicles that get released from the stem cells. That's all in that serum. I wish we need to put that chart in there, because we have a chart that has all the ingredients. It's fascinating what's in there, but all of those are not anti-inflammatory. Some of them are, but they're all designed to repair and heal tissue. So we get the best of both worlds.
So an injury could be
Potentially.
cured, whatever.
Potentially.
That's not really your main goal. Your main goal is like a pain management.
You know, it's ideally healing. Pain, well, I mean, I am a pain man. I'm a reform pain management specialist, not a regenerative medicine specialist. But yeah, the goal is pain relief so you can function, but it's also to heal the underlying issue. Yeah, we don't see that consistent, right? But what we do see is improved function and people can live their lives again for several years to come. You know, we'll get follow-up MRIs, sometimes we see changes, sometimes we don't. I had a Phoenix Suns player that we took care of, did PRP in his spine. Injured himself a year later, got a follow-up MRI, we saw reversal of degenerative changes, which is really unusual. We don't see that all the time though, I can give you 100 other people that didn't have reversal of degenerative change, but they had relief and improved function. That's a great question. So it's more than just anti-inflammatory, that's serum from the Regenerative program, it's more than anti-inflammatory. There are growth factors, cytokines, all these signaling molecules, extracellular vesicles, exosomes, mitochondria, mRNA, all the stuff our body needs to signal the tissue to divide, repair, and heal itself.
Do you recommend any supplements in your garden? Getting in your body?
Yeah, for the soil, yeah, you know, vitamin D is probably the big one. So, you know, ideally we always check a vitamin D level. Optimal vitamin D levels are associated with better stem cell function, they're associated with better pain, better immune system, better bone density, all that stuff. So vitamin D is a big one. Magnesium for some people too. I think we've learned through the years that most people are magnesium deficient in the US. Like you can check magnesium levels, but that shows what the levels are magnesium are in the blood, not inside the cells. So there are some specialized tests that we can order that actually check the magnesium levels inside the cells, and that's kind of what we want to do. But those would be the big ones. I mean, a multivitamin if you're not getting your food, your nutrition through food. Yeah, but that's all individualized. So. Oh yeah, there's a supplement company called Qualia, and I've gotten to know the chief scientific officer, Dan Party, really well. Guy's brilliant, love extraordinary human being, brilliant mind. But they've created a whole stem cell line. They've got a protocol where you take NAD, which a lot of people have heard of NAD. Every cell in our body needs it. It's important for mitochondrial health. Without NAD, we're dead. So luckily all of us have NAD in our bodies, but we can actually supplement and give our bodies an extra boost, if you will. But they have a whole stem cell line, which has a stem cell supplement, all natural, which boosts our natural stem cell production. They have a senescent line, which is part of this protocol. Senescent is basically it's a supplement that gets rid of your dead cells, all your zombie cells in your body that are just sitting there creating inflammation, wreaking havoc on your body. This supplement can help clear that out. And that combined with the NAD and stem cell product can really boost your stem cell. They've done several studies that have shown that you can have a significant increase in your own natural stem cells. So that's an option for people. You know, they're not going to commit to the diet as much as they should. Yeah.
In Europe, they're doing a lot of research on sound waves, so the last 30 years, they've had very good results with regenerating tissue. Have you looked into that then?
Oh my gosh, so I'm a big music guy, like self-talking guitar player, sound
Repeat the question, please.
Oh,
Repeat
she was asking about sound therapy. She's like, in Europe for the last several decades, they've been using sound waves to regenerate tissue. They're also using it to target cancer. Phenomenal. Yeah, I mean, we're all vibration. We all have these atoms in our bodies that are vibrating, right? We manipulate the energy around us, we can change our structure. 100%.
Are you doing any of it in your clinic?
Not in my clinic, but so there's PEMF, pulse electromagnetic field therapies, like a PEMF, or PEMF, that's using the same concept. There's a company called In Harmony. They have PEMF combined with the vibroacoustic technology. So they're using sound waves, and you have different protocols. I haven't looked too much into it, but it's pretty fascinating. But I'm all about the sound, music. Yeah. Yeah. Yes, sir.
If someone goes through the full program, whatever you might want to call that, what do you think?
Of course.
What do you think the cost is?
It varies from person to person.
All right,
Yeah.
what can it get up to?
Let's see, anywhere from start at low end 5,000 to 25, 30,000.
Because that's what she spent on the first deal with stem cells and PRP.
Yeah.
And just curious if
And we don't know where they came from.
You go to work.
don't touch me.
No, and you know, the other thing was like, The umbilical stem cells, the placental stem cells, is that someone else's DNA, right? I just don't know how I personally feel about that yet. I mean, I know a lot of people are doing it, but to me, that creeps me out a little bit. I just, we have the tools to use our own stuff. And we have the tools to make it really good. Like a lot of people, like, I'm doing these treatments on 90-year-olds, right? 92-year-olds. They're like, "Am my cells any good?" I'm like, we'll make them good. You can make them good. Soil, diet, nutrition, sleep, hyperbaric oxygen, light therapy, physical therapy, movement, all of that. You can, yeah, exactly.
Red line, is that good?
I'm a big fan of it. Like, yeah, there have been a lot of studies on what we call photobiomodulation, PDF. Yeah.
Did you go through your program and not do the injection?
Oh, yeah. Oh, yeah.
You do everything else?
Yep. I have several people. I got people who hate needles and they're like, "I'm not doing that."
You mean
Great.
somebody like me?
Yes. See, good salesperson. Is all of the equipment that you've talked about at that location, or do we go elsewhere?
Hyperbaric oxygen therapy is at Benesair Health, which is Dr. Carrie Rodinko's practice, right by HA's, so off Scottsdale and Lincoln. So we don't have hyperbaric in our facility. Carrie is doing a tremendous job with hyperbaric. She's the only person I trust. Myself, I do it once or twice a week. I'm in there just for my own wellness and health, and I love it. It's one of my favorite longevity tools that I've found. But she's the only person I trust. I will only ever get into her chambers. Yeah, but everything else we have in our office. Food, well, that's your place, but the light, no, I know, the laser light therapies are replaced, and physical therapy we outsource. We don't have that in the house either. So, but I've now worked with extraordinary physical therapists all over the valley. So we can help you find the right people.
You talked about cutting out sugar, which is pretty obvious for everybody. But would you think that people coming to your program could cut out even remotely more than 25%?
It just depends. It depends. I mean, we have that conversation, and it's a process. I mean, my wife will tell you I'm a sugar addict. I was. I've got it under control, but it took years. I mean, I was a closet junk food.
Yeah, no, without peanut M&Ms. They've got
Well, I found justice.
Substitution.
Yeah, you find substitution. Exactly.
There's nuts in the locker room too.
You put it chocolate on. Dark chocolate.
Yeah, dark chocolate is great. Yeah, 70% or higher. Actually, studies have shown that like 70% or higher dark chocolate actually stimulates stem cell production in our bodies.
70%.
70%. Yeah, very healthy. Hey, I know that guy.
You didn't pay me to come here, but to give a quick testimony, but then after all of this, I'm a wimp about needles as well. I have severe pain in my right knee. I'm a cyclist. I ride about 250 miles a week. And all of a sudden I couldn't get on my bike because of degenerative pain in my knee. Amy has seen Dr. Goyle. She told me to go. I'm here with zero pain in my right knee and then back to 250 miles a week on my bike, even though you probably don't want me to do.
No, I want you. That's the whole point. Keep on going.
But I will say that, the prepping the soil, when you know how much you're going to invest in this procedure, you want the soil to be as good as possible. So it's good incentive to cut out the sugar and to eat properly. It's good nutrition. As you said, you are an anesthesiologist. The ketamine makes this very, very tolerable. You're out 100%, so the recovery from that is quite easy. I think it's called twilight.
Yeah.
So you can't wake up. You realize, hey, what are you doing? Put me back.
Yeah. No idea what's going on.
So all of everything that you have said, I would say is very true, including your team, your wife, your laser techs, everybody else in your office is. It's a very pleasant place to go.
Thank you.
Thank you for being here.
Thanks for my pleasure. Thank you for sharing that because I feel like we've really built something truly special. It's real, it's authentic, no BS, no fluff. It's just real people, really care.